Hello, my name is Samwail Nassif, and I'm a P3 student at Florida A&M College of Pharmacy, and this is my journal club for EBM. The article that I've selected is called "The Effect of Fixed Dose Combination of Isosorbide Dinitrate and Hydralazine on All Hospitalizations and on 30-day remission rates in patients with heart failure." Results from the African American heart failure trial. The authors of this article are Inder S. Anand, Sithu Wen, Thomas Rector, J. N. Khan, and Ann L. Taylor. The funding was funded by a research grant of NitroMed. No funds were provided for the analysis presented in this article. Resources of the Minneapolis VA Medical Center supported this analysis, and Dr. Rector was also supported by the VA Clinical Science and Health Service Research and Development grants. In the African American heart failure trial, some background information. It was published in 2004. A fixed dose combination of isosorbide dinitrate and hydralazine reduced mortality by 43% and first hospitalization for heart failure by 37% in the African Americans who had heart failure. Reduction in mortality makes it difficult to determine the effect on hospitalizations unless the analysis adjusts for death as a competing risk. Therefore, in order to test of how isosorbide dinitrate and hydralazine affect morbidity rates, the study uses statistical methods to adjust for death to determine this drug's efficacy on reducing hospitalizations, as that would represent greater health of the patient as well as decrease the healthcare costs. The objective of this trial was to estimate the effect of the fixed dose isosorbide dinitrate and hydralazine on first hospitalizations, all hospitalizations including recurrences, and the 30-day all-cause readmission rates in subjects who were discharged alive from their first hospitalization for heart failure in the African American population. The trial design for this was randomized, placebo-controlled, and a double-blinded trial, so very unbiased. It was done at 161 centers in the United States, and the study was approved by the Institutional Review Board at each center, and all the subjects provided with written informed consent. Who is included in this trial? Patients who are 18 years of old or older, 18 years of age or older, self-identified Black patients who had New York Heart Association Class 3 or 4 heart failure for at least 3 months. Patients were required to have been receiving a standard therapy for heart failure, including ACE inhibitors, ARBs, beta blockers, digoxin, spironolactone, and diuretics for at least 3 months before randomization. And patients who have had evidence of left ventricular dysfunction within the 6 months before randomization in the form of a resting left ventricular ejection fraction of no more than 35%, or a resting left ventricular ejection fraction of less than 45%, with a left ventricular internal and end diastolic diameter of more than 2.9 centimeters per square meter of body surface area, or more than 6.5 centimeters of the basis of endocardiography. Who is excluded? Women who were pregnant, nursing, or childbearing, or of childbearing age, and not using an effective method of contraception. They were excluded from the study. Also, patients with acute myocardial infarction or acute coronary syndrome or stroke within the past 3 months. Cardiac surgery or percutaneous coronary intervention with the preceding 3 months of the likelihood of requirement for such procedures during the study period. Patients who had significant valvular heart disease, hypertrophic or restrictive cardiomyopathy, active myocarditis, or uncontrolled hypertension. Also, patients with a history of cardiac arrest or life-threatening arrhythmias within the last 3 months, patients with potential need of cardiac transplantation, patients who had symptomatic hypotension, patients with the presence of an illness other than heart failure that can result to death, patients who are unable to complete the quality of life questionnaire and contradictions to those of nitrate or hydralazine therapy. A total of 1,050 self-identified African American patients were randomized. 518 were using the isosorbide dinitrate, and others were using a placebo. The primary endpoint was a composite score composed of weighted values for death from any cause of first adjudicated hospitalization for heart failure and change in the quality of life. The secondary endpoint included individual components of the primary composite score, death from cardiovascular causes, the total number of hospitalizations for heart failure, the total number of hospitalizations for any reason, the total number of days of hospitalization, the overall quality of life throughout the trial, the number of unscheduled emergency room and office or clinic visits, the change in B-type natriuretic peptide level at 6 months, a newly recognized need for cardiac transplantation, and a change in left ventricular ejection fraction, and the left ventricular wall thickens for at least 6 months. Follow-up: no patients were lost in the follow-up. Population or a total of 1,050 self-identified African Americans were used. The statistical analysis and the results. The data results from the trial were adjusted for death based of fine gray model to look at the effects of isosorbide dinitrate and hydralazine on first hospitalizations only, all hospitalizations including recurrences of heart failure, and 30-day all-cause readmission rates in subjects who were discharged alive from their first hospitalization for heart failure. When using the fine gray model to study the effect of this combination drug on heart failure, the hazard ratio was 0.61, showing that this drug resulted in a 39% reduction in first hospitalizations compared to placebo, as 251 patients on the placebo experiencing a first hospitalization for heart failure in comparison to 173 taking this combination drug. With a p-value of less than 0.001 and a confidence interval ranging from 0.47 to 0.80, this information proved statistically significant for all first all-cause hospitalizations. It also showed a 12% reduction and a 0.88 hazard ratio from a confidence interval ranging from 0.72 to 1.06. This data was not statistically significant as the p-value was determined to be 0.18, yet it is still important to note that a reduction did occur as 558 patients on placebo experienced the first hospitalization compared to 435 on the isosorbide dinitrate and hydralazine. The study not only looked at first hospitalization but also looked at the fixed drug's efficacy on all hospitalizations by comparing recurrent hospitalizations for heart failure to all hospitalizations and their cause. When looking at the data for all hospitalizations for heart failure, the results showed a 34% reduction with the use of this combination drug, as well as a 25% reduction for all hospitalizations compared to the placebo. Data was also collected and interpreted regarding the efficacy based on a 30-day all-cause readmission test in subjects who were discharged alive from their first hospitalization for heart failure in this trial. The data collected showed that isosorbide nitrate and hydralazine caused a 41% reduction in a 30-day readmission rates, and since only 14.8 of patients taking this drug versus 23.6 on placebo experienced a 30-day all-cause readmission rate, Statistically, this data was not clinically significant since the p-value was 0.12. Baseline characteristics of the subjects with the first hospitalization for heart failure in each treatment group were compared using two sample t-tests for means of continuous measures and a Pearson test for proportions. There were no adverse effects in this trial. The conclusion that the authors came up with, because hospitalizations for heart failure were highly distressing and expensive, it is important to find an effective treatment. In the study, secondary analysis were conducted and showed consistent evidence that the isosorbide dinitrate can substantially reduce the commonly occurring hospitalizations for heart failure and thereby the total number of burden of hospitalizations. The strengths and the weaknesses of this trial, it's a very strong study because it was randomized, placebo-controlled, and double-blinded, and that makes the chance of bias very small, since this is a considered gold standard type of study. Not only is it strong, but it is inherently as strong as it addresses a relevant research question that adds new important evidence-based information to heart failure treatment, specifically for African Americans. Also, an independent central committee adjuncted the cause of all deaths and hospitalizations, leaving less room for potential bias. What is weak in this? It was funded by research or grant from Nitromed, and Nitromed has ownership of this patent for this fixed drug combination, and that could lead to a potential bias. Although 1,050 African Americans is a great number, a larger population size would be more effective in this trial. Also, there is not a control group of non-African Americans using the drug, so it's unclear whether it's only effective in African Americans or compare that to other races. The conclusion, researchers were able to gather statistically significant results showing that this fixed combination drug does indeed positively affect African Americans with heart failure. Therefore, when treating African Americans with heart failure, this information can be applied as add-on therapy, and as done in this trial, since isosorbide dinitrate and hydralazine is associated with substantial reduction in the total burden of hospitalizations. In addition, the results from this trial not only help with patient care but also reduce healthcare costs, since this fixed dose combination drug decreases hospitalizations.